Hello and welcome to the Health from Mzansi podcast, where we explore the stories of those transforming the world of health and medicine. Today we have an inspiring feature on Professor Ntobeko Ntusi, a leading figure in South Africa's healthcare landscape. From his early days growing up in Umtata in the Eastern Cape, to becoming one of the country's most respected cardiologists and academic leaders, Professor Ntusi's journey is a testament to passion, perseverance, and a commitment to advancing healthcare for all South Africans. Professor Ntusi, thank you so much for joining me here on the Health for Mzansi podcast. We really aim to celebrate people within the healthcare sector, to really celebrate them for the contribution they make day to day, and just to say thank you. So I would like to just, as a start, thank you for all of your amazing work within the healthcare sector, not only within South Africa, but globally. Welcome.
Thank you very much, John. It's an absolute pleasure to engage with you on this platform, and I'm delighted to begin this interview with you.
I usually like to start with growing up years, where it all started, where your foundation was laid. Could you share more about your early life in Umtata and how your growing up really influenced your decision to pursue a career in medicine? I must say, I love that region of South Africa. It is absolutely stunning.
I grew up in Umtata. I come from a family of 3 boys. My mom is a social worker by training, and she worked at the University of Transkei in Lamro, as well as the Sobe University. And my dad, who has trained in chemistry, worked as initially a inspector and later a director in the Department of Education for the then Transkei. And I had a very idyllic childhood, grew up running on the dusty, undulating hills of the Transkei, and really loved my childhood. And probably one of the most enduring memories from my childhood are the relationships I had with my teachers, were wonderful role models and instilled in me not only a love of learning, but also a love of mentoring and imparting knowledge to others. And so as a young child, I wanted to go to university so that I could study to become a teacher and to try and influence the lives of other young people in positive ways that my teacher had done so for me. And unlike most people who knew from when they were very young that they wanted to become doctors, I wanted to be a teacher for a very long time and only made the decision to go into medicine quite late.
That's so amazing. Just reflecting on how far you've come, medicine wasn't your first choice. That's very interesting to kind of reflect on and think about, because you're now the South African Medical Research Council's new president and CEO. Congratulations on that. Great achievement. I think this is just one of the many that I can list as part of your career. If you can share a bit of a timeline of your career, from where you chose to do your undergraduate studies, and how did the liberal arts of your education really shape your approach to medicine and research? This was, of course, at Haverford College. Thanks.
So in as much as I ended up not becoming a teacher, I felt very fortunate in that in the work that I do, I still do about teaching to my patients, teaching to students, and teaching to the families of those I care for, but now increasingly doing a lot of teaching to my peers as well. So it remains passion, one of the most fulfilling aspects of my work. In terms of my trajectory, I did my basic schooling in Umtata, and when I was 14, my family relocated to the US. My mom was doing a PhD at Greenmore College in Philadelphia. I ended up finishing high school in Philadelphia, graduated from Lower Merion High School, and at the time had applied to study medicine at UCT and had been accepted, but was quite fascinated with the whole concept of liberal arts education and decided to apply to a liberal arts college. In fact, one of the top liberal arts colleges in the US at the time, which was just down the road from my mom's university. I was lucky to be accepted. I registered for a Bachelor of Science in Cellular and Molecular Biology and ended up doing a double major with medical sociology and graduated from Haverford College with honors in 1998. I applied to study medicine in the US, but my parents got divorced. It was a very difficult time. And so I applied again to the University of Cape Town and was grateful now to be accepted, and came back home to study medicine and graduated with a MBCHB degree from UCT in 2003. I trained as a doctor in South Africa during the late 1990s and early 2000s as the devastation of AIDS was unfolding. I completed my medical internship and community service, respectively, at Prayer Hospital in East London, South Africa, and then following a formative 2 years in East London, which sparked a lifelong passion for evidence-based healthcare, health systems research, and universal health coverage. Decided to come back to Cape Town to train as a physician. I graduated from the Colleges of Medicine with a fellowship of the College of Physicians in 2009, and was about to embark on my training in cardiology when I successfully applied for an opportunity to go to Oxford to do a postdoctoral fellowship. So I've been doing a MD or PhD in cardiology alongside my clinical training as a physician. So I moved to the UK beginning of 2010 and ended up registering for a second PhD at DPhil in cardiovascular medicine, looking at the role of cardiovascular magnetic resonance as a tool to study disease mechanisms in people with inflammatory forms of heart disease, and graduated with the DPhil in 2014. I then returned to Cape Town to train as a cardiologist. Graduated again from the Colleges of Medicine in 2016 and also graduated from my medical doctorate or MD degree from UCT, and then applied for the chair of medicine at the University of Cape Town and headship of medicine at Philadelphia Hospital, which is the job I've done for the last 8 years.
All I can say is wow, wow, wow. Just looking at your travels and what you've done and all the places you've been, just as part of mapping out your career, you really are a global citizen. And I think for that, it must make your approach to medicine, working with people, very different. So I'm looking forward to picking your brain on that. But I think more importantly, you left South Africa to go to the US and then you came back. So it was also a very challenging time for us as South Africans during all of that. How did you manage? How did you cope? You spoke now briefly about your parents also splitting up. How did you keep a level head throughout this? And then I also want to also ask you a little bit more about your training as a doctor that coincided with the height of the AIDS epidemic in South Africa. How did this, experience shape your perspective on healthcare and research?
In terms of the experience in the US, that was an incredible experience. And I went there during my formative years. I was grateful to have been there with my family who provided ample support. I grew up as a normal teenager with many of the similar challenges. People who are discovering themselves and finding their own voice in the world. And it was an interesting time in the history of this country around the infancy of our democracy, but it was also a very interesting time to be in the US. And certainly to be going back and forth between these two, I think significantly shaped the person that I've become. The experience of training in medicine at the height of the HIV epidemic was utterly transformative. I went from spending many hours every day in wards full of people that are diagnosed with HIV, for whom we could do very little because our government didn't believe at the time that antiretrovirals were. And then getting access to these treatments that were absolutely life-changing and saved the lives of many people. And at that time, the commitment to work in the health system to try and understand the importance of good access or the formations of universal health coverage is an important principle and to really try and have a career where as impactful contribution as I could make were really formed in those early years by training.
What inspired your specialization in cardiovascular medicine? And if you could also share some key moments from your fellowship and doctoral research at Oxford and the University of Cape Town.
Certainly. So I wanted to go to medical school to be an obstetrician. In my final year of high school, our science teacher, our biology teacher, had come down with a cold, and the school wasn't able to get a substitute teacher in time. And so we had a period where they didn't know what to do with us. And so somebody had a videotape of childbirth and decided that they would let us watch the duration of the 45 minutes of the period. And I sat in this classroom surrounded by my pubescent peers who made lots of juvenile jokes about the video. And for me, it was a very special moment where I hit a eureka moment and thought to myself, this is what I want to do with my life. And to be involved in the beauty and myth of childbirth, working with essentially helping women, and to be involved daily in bringing new life into this world. And so I decided to go to medical school so that I could be able to do this every day. I could not wait to commence my 4th year of medical school so I could spend time in the labor ward, and my experience was anything but positive. And I actually almost dropped out of medical school because I thought if I wasn't going to be an obstetrician, what was the point? And then my next rotation was medicine, and I fell madly in love. Sense of inquiry, the ability to use your mind and have a very intellectually stimulating approach to problem solving, all in service of the patient was unwell. And at the time I rotated in cardiology, my first attraction to the unit were really the people. I loved my patients there. I had many of my role models based on cardiology. And so the attraction was really initially around the people. But as I spent more time around them, I increasingly thought to myself, this is a discipline where there were many unanswered questions, and I thought I could contribute through research to addressing fundamental questions of relevance to African health, cardiovascular health. But also, as I learned more about the discipline and realized that, as with other parts of the world, in Africa, we would be seeing an epidemiological transition characterized by hypertension, diabetes, obesity, and cardiovascular disease becoming the major killers, surpassing infections. It would be important as a public health imperative to have organized cardiovascular health systems to be able to cater for the needs of the population. And now, since 2012 in South Africa, cardiovascular diseases being the leading cause of mortality, and many countries on the African continent undergoing that transition. And I think it's an incredibly exciting space to be working in and trying to contribute some of the solutions to this new epidemic.
Connected to the last remarks you made, the significant contributions that you've made in understanding cardiomyopathy and the use of cardiovascular magnetic resonance. Maybe if you can just briefly for the audience explain those two concepts firstly, and then if you can discuss some of the most impactful findings from your research. And then just one comment, I was smiling as you were talking about bringing life into this world, and that's where you also found a home working with your patients there. I was speaking to a midwife recently, and she expressed it so beautifully. So I think that's really something special in the medical space. So I also just wanted to comment on that. But thank you so much for sharing and also just talking more about your research. Thanks, sir.
Our group work primarily in the domain of non-communicable disease, epidemiology, and multimorbidity. And within that, we focus on 3 areas. So as you mentioned, we do lots of work on cardiomyopathies, which is a fancy way of saying disorders of heart muscle. The other area where we work is that of resistant hypertension. So people with high blood pressure who are difficult to control and to treat to target, despite being on multiple drugs. And many of these often take more than 3 antihypertensives. And so we study disease mechanisms and try to understand optimal strategies for treating difficult to manage hypertension. And then 3, we work in the domain of inflammatory heart disease. So we look at autoimmune conditions that involve the cardiovascular system, people with HIV-associated cardiovascular disease, TB of the heart, rheumatic heart disease, and other similar conditions. So we use a number of approaches to study these conditions. We do a lot of basic science work where we use molecular biology to study disease mechanisms in the laboratory, and we've got a particular interest in understanding the genetic underpinnings of cardiovascular disease amongst Africans. In addition to the lab-based techniques that we use, we also do a lot of imaging where we take pictures of the heart. These help us to be able to stratify different forms of heart disease, but also to study disease mechanisms, to be able to make a specific diagnosis, to study the natural history of these conditions and see how their images of the heart evolve as the disease progresses, to use imaging to look at the efficacy of our therapeutic interventions, and also to track disease progression over time. And increasingly, we are using these imaging biomarkers as tools both for clinical trials, but also for measures of disease outcome. And our group has also used different approaches, including clinical trials in the space, but also starting to do a number of implementation science studies as well as population-based studies. But to come back to your question around some of our contributions in relation to the use of MRI to study disease mechanisms, we've applied this to different forms of cardiovascular disease in the context of cardiomyopathies to describe the different forms that we see amongst South Africans, which may be dilative or hypertrophic or infiltrative or arrhythmogenic forms, and to study both acquired and familial forms of heart muscle. And so we have looked at not only what we call phenotype or structural forms of heart muscle disease and their prevalence amongst South Africans, but we've also looked at the contribution of tissue characteristic changes like the burden of fibrosis or scarring of the heart muscle, or the burden of inflammation of the heart muscle, and to understand what some of the drivers of these are in different populations, but also to use imaging to predict outcomes in people with these conditions. And we've similarly applied these techniques to people with high blood pressure or people with HIV that involves the heart muscle. So that's part of what my research group does.
Doctor, you've been involved in policy development and capacity building across Africa. Can you elaborate on some of the initiatives you've been part of and the outcomes?
Certainly. So I've been grateful to have been able to contribute to national and international guidelines on cardiovascular disease, as well as the development of strategic frameworks and policy documents in this country and globally. And so work with the National Department to contribute to previous versions of the National Strategic Framework for the prevention and management of non-communicable diseases, and in particular cardiovascular disease in this country. I've similarly given input into policy documents led by the Pan-African Society of Cardiology and have contributed to guideline frameworks and consensus document statements from the Society for Cardiovascular Magnetic Resonance. But one of the really impactful contributions has been through some of the professional and research networks that I've been part of. And one of the more impactful ones is the CAMERA network, which stands for Consortium for Advancement of MRI Education and Research in Africa. So I was one of the founding members and sit on the board of this network of individuals from all around the world who are interested both in developing capacity, improved education for MRI performance on the continent, but also to support MRI-based research in different countries. And it has been a very fulfilling experience to see the transformative power of individuals who are united by a common purpose and to make a difference on the continent.
As you're well aware, the National Health Insurance Bill is an area that has caused quite a bit of discussion in the country. And I just wanted to get your take on this aspect and kind of to find out from you what you think about it, but more so, how does the National Health Insurance Bill aim to address the disparities in healthcare access and quality across the different regions and socioeconomic groups in South Africa? Thanks.
The National Health Insurance Bill, or NHI for short, is an incredibly important instrument to promote health equity and access in this country. The bill, as it stands, is premised on the principle of universal health coverage, which speaks to people being able to access health care at institutions of health closest to them. It speaks to concepts of equity, affordability, accessibility, as well as health justice. And I think there is nobody who will argue against these principles. The passage of the bill surprised many people because many of the frameworks are in details around how this important initiative will be funded and how it will be operationalized have not yet been clarified. The current situation we have in this country, where we've got these two parallel health systems that exist side by side, one oversubscribed and underfunded, and the other unsustainably expensive and taking up a disproportionate amount of the health expenditure, is a situation that is both untenable and unsustainable. And so the goal of NHI is to bring about redress and parity in the health system. And as the president of the MRC, I'm delighted that we have a number of really important intramural units within now the organization that look at health systems and their functioning, that look at our financing, that look at the burden of disease, looking at issues of gender and health and the environment. These are all critical to considerations around NHI. And in the coming weeks, I am planning to host colleagues from the Ministry of Health to have a dialogue around how we can support some of their planning for implementation of NHI and to consider strategies or development of evidence that can inform how they make evidence-based claims for NHI for our country.
Thank you so much for your time, Doctor. I think we could probably speak about all of these areas for days. But just looking ahead, what are your visions for the future of cardiovascular medicine and healthcare research in Africa? And how do you see your role evolving?
So I'm really excited to be commencing my tenure as the president of the SAMRC, which I think is a critically important stakeholder for advancing health in this country and beyond through research and innovation. And over the coming years, I hope to shift the focus of the work of this organization to focus more on NCDs, including cardiovascular disease, to look importantly at the intersection of NCDs and infections, to only in a systematic way look at interventions around the application of AI and digital health technologies in the entire health research value chain, to study the impact of the planetary crisis and climate changes on the healthcare of South Africans. But in doing this work, I also recognize our position on the tip of the continent and our ability to serve as a gateway to the rest of the continent. And so hoping to work very closely with other science councils in the African continent, ministries of health, as well as scientists to support their endeavors to improve not just cardiovascular health, but the health of their populations through generation of new knowledge or applying existing knowledge in new ways, and to support the expansion of high quality and impactful research in the region, as well as the development of capacity through training of individuals that work in health research in our region.
As we've learned today, Professor Ntobeko Ntusi's career is a shining example of what can be achieved through dedication, innovation, and an unwavering commitment to improving healthcare. His vision for a more equitable health system continues to inspire the next generation of medical professionals. Thank you so much for your time, sir. If you found this episode inspiring, be sure to subscribe for more stories of extraordinary individuals in the world of healthcare. Until next time, greetings from me, Don Numdu, our technical producer Megan van der Vent, and the rest of the #Team Health for Mzansi. Stay inspired.